I'm going to talk about one more example about how to use the optimization tool in the real world. This example is called COVID-19 patient assignment. It's a kind of supply and demand problem. As we all know, there is a disease called COVID-19. It spreads quickly and people are easy to be infected. One of the approaches to prevent infection is to separate COVID-19 patients and the non-COVID-19 patients to different hospitals. So in this model, we will first decide which hospital will only accept COVID-19 patients. The second set of decisions is for each hospital and region, how many patients will be assigned. For example, in region 1, 10 COVID-19 patients will be assigned to the hospital 1 if hospital 1 is decided only accept COVID-19 patients. Also, in this model, we have 3 important rules. The first is the type. As mentioned above, COVID-19 patients can only go to the hospital which is decided only accept COVID-19 patients. So this rule is a connection between the 2 sets of decisions. The second rule is the capacity. So for each hospital, it has given number of providers, limited medical resources, and a limited number of operation rooms. So the assigned patients will not exceed the capacity of the hospital. The last rule is a backlog. We are given the total number of patients need to be assigned, and the assigned patients will not exceed the backlog. The next section is the metric. So in this model, our goal is to assign as more patients as possible. Since we have a rule called backlog, so the best case is all the patients in the backlog will be assigned. This model still have some limitations. One of them is a variable number of patients. So in the real world, the number of patients is not fixed. Some patients will recover themselves and there will be new infections. So if we can take the dynamic process into consideration, the model will be better. The next limitation is the variable hospital resources. So similarly, the hospital resources is also not fixed. It can be changeable. So we should also take that into consideration.